Hi guys, so I'm gonna go over some concepts in cardiac devices today as well. So this is on ICD therapy, and ICD stands for implantable cardioverter defibrillator, and we're gonna talk about the ICD therapy and its ATP function. ATP stands for Antitachycardia pacing, and we talked about the SAT discriminator and the detection of ATP last time. Um, So how ATP is detected is that under ICD therapy there are two categories. So one of them is low power and the other one is high power. So the pacing part is low power and the high power is that shock power. So high power would be cardioversion and actual like defibrillation. And for antitachycardia pacing, the method would be when tachycardia happens, uh, there's re-entrance circuit going on. So let's say in the left ventricle, this re-entry circuit is initiated, and the job of this ATP is to terminate that and bring the beat to the normal beat. So the beat that re-entry initiates, those beats they're gonna be fast. And how ATP fix it is they're gonna do a even faster beat to take away that re-entry beat that they're being initiated and actually take the control of the beat, and they're gonna bring it to normal beats. And there are a couple methods that they do this. There's sequence and two types of these ATP. There's one called burst and ramp. So sequence basically means that this is all programmable values. Their sequence you can usually not it's usually three sequences that you can program into, but this is, like I said, it's up to the cardiologist to put how many sequences they want to do. It's all programmable. So if you were to talk about what you could program into this setting, the percentage and the number of purses and number of sequences. So percentage would be similar to what we talked about in last concept. So you can program this adaptive percentage usually somewhere around 70 to 80 to 90%. And to get this number, you take the last four beats coming to that detection. So it would be TS, 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 and TD, TP. And that interval between TD and TP, we're going to calculate that by taking the last four intervals and having that average multiplied by the percentage. So let's say the last four bits were 350, 360, 360, and 370. So average of those four bits is 360, right? And if the adaptive percentage is 9%, we calculate it, but let's go with if it's 330 or something. So you're gonna apply that 330 into that interval. That's gonna be the first of the first sequence of that therapy. It's gonna be 330. Let me actually do the calculations. I don't wanna be misleading. So it's actually 324. So the first interval is gonna be 324. So if you have set the number of sequence as maybe 3 and number of pulses at 6, if you're in the burst therapy, those intervals 324, they're not going to change. So that 324 interval, 6 of those intervals are going to be applied to fight against that recurrent fast tachyarrhythmia. And if it works, it brings it back to normal beats. If it doesn't, after the 6 beat, the therapy stops and it's gonna let it detect again. And if it comes again, the sequence 2 of that therapy will be delivered. And it's gonna be same 6 courses with 324. And actually, I just lied. It's not. It could be 324, but there's this setting about decrement number, and usually it's 10. So this is actually called the interval decrement. So usually it's 10 milliseconds per cycle. So if I let me go back to the first sequence. Sequence 1 through 24, 6 beats, 6 intervals, and it ends. And if it is still in the PT criteria, it will subtract 10 milliseconds off of that interval 324. So in sequence 2, they're going to deliver the interval of a little faster interval with 314. So 314 milliseconds is faster than 324 milliseconds. You guys understand that, right? I mentioned this in the last video too, so you can check back. And I hope you guys understand when I say it's still in the VT zone. So if the criteria was set to 300 and 400 milliseconds for interval, if they're within that period, they're still in VT, so they will sense it as tachycardia. So let me go back to all this. We'll fill burst therapy, and sequence 1, sequence 2, and same method for sequence 3. If they're still redetecting tachycardia, they will again apply that 10 millisecond decrement. Then they will apply that, and they will deliver that 6 burst of 304 millisecond beat in order to terminate that tachycardia coming from that reentrant circuit. So this was about the first therapy of the antitachycardia patient.